Again, welcome everybody to Family Therapy. My name is Natasha Cheney. I am the founder and director of Family Therapy, and tonight we're going to talk about how working with a therapist can help you prepare for your Refugee Board hearing. Okay, so here at Family Therapy, we are social workers and psychotherapists. All right. And many of us are first generation Canadians, or we are immigrants ourselves to Canada, newcomers to Canada. So we've lived part of the journey that you have you're experiencing right now, changing, adapting, getting used to the cold weather outside, Canadian cultures, speaking English, and being away from your own community. So we are actually for myself, being a therapist who works with refugees, I'm very passionate about that work, as my parents were newcomers to Canada and they had to adjust to changes. And it's something that is very close to my heart. Just go next. There we go. All right. So I'm going to talk a little bit about mental health. All right. We here at Family Therapy, we are trauma-informed therapists. We are culturally sensitive. And we understand that coming to Canada has been a huge transition for you. And it has impacted how you see the world, how you relate to people, and how you feel about things. All right, some of you have been through some really horrific experiences. Some of you may have come through refugee camps. And most of you came to Canada, not because you wanted to but because you had no choice and you came to seek safety. And that really impacts your mental health. And that's our job as mental health specialists, as therapists and social workers, to help you come to terms with things, help you understand, help you process trauma. As you can imagine, and this is even my own experience as well, there are lots of barriers for counseling, and some of them are very simple ones, and some of them can be more complex. All right, so when we think about things like even language, even though some of you speak English, Nigerian English, Cameroonian English, English from Zimbabwe or Kenya is different than the English we speak here in Ottawa, Canada. So many of my clients who actually don't speak English, speak French, said to me when they first went to Quebec, they didn't even understand what people were saying. So language can be a barrier to even accessing counseling services. And here, if you do not speak English, or English is not your native language, or you're uncomfortable in English, we can access interpreters for our counseling services. Stigma is another huge, and that's actually probably the biggest barrier, stigma and practical needs and practical issues. I come from a culture where speaking with a therapist was seen as taboo, meant you were crazy, meant there was something wrong with you. Normal people don't speak to a therapist. And if you haven't ever seen that in your own culture, in your own communities, there can be fear of going and speaking with a therapist. What will other people think of me? What will even my partner or my spouse think of me? Will impact how my children see me as well. And I want to let you know that here in Canada, we see seeking out mental health as a sign of strength, as a sign of empowerment, that you know you need some more support than what you have already. And we say in your own toolboxes, okay? Lack of knowledge. I have had clients come and talk with me after they've had a failed refugee board hearing, saying they did not know they could access counseling services. As a refugee claimant, you access counseling services through your insurance program, the Interim Federal Health Plan. So our services are covered through your insurance program, so they are, I'll say, essentially free to you. The only price you have to pay is going to see the doctor, which again is covered by your insurance plan, talking with a doctor or a nurse practitioner, and getting us a referral from a doctor or a nurse practitioner for counseling services. So your insurance covers us, but in order for your therapist, including myself, to get paid for the time that we spend with you, we need that counseling prescription in order to get approval from your insurance company, the interim federal health plan, for us to provide counseling and care for you. So for every 10 hours of work that we do for you, we need a new prescription. Okay. Cultural differences, I did talk a little bit about that. Different cultures see communicating and talking with a mental health professional differently. And I know even for myself as a child, I had a mother who had a long-term illness, and when I started seeing stuff when I was old enough to actually really understand things, I remember saying to my family, we need to go talk to somebody because mom's illness is impacting all of us. Practical needs, when you first arrive in Canada, seeing a therapist is not the first thing on your mind. You're more focused on, where am I going to live? I need a job. I need to adapt to this weather. I don't want to be living in a transitional house or a shelter anymore. So there are a lot of practical needs that get in the way of accessing counseling services. And I want to let you know that we do have therapists who work evenings. We have maybe a couple of therapists who might be able to see clients on weekends. And most of us offer sessions throughout the week. So we try to make our services accessible to you to meet your schedules as well, but also it has to come within our schedules too. So it's a balance between A and B. All right, and some of the practical needs also are things like filling out our forms. So one of the things I've started here in our practice is we have an intake worker who will help you fill out the paperwork. All right, and there's a lot of questions we want to ask you before you see your therapist, so your therapist gets to know you a little bit better before they even meet you and they understand what your case is about. I'm going to go with distrust and fear of legal repercussions, and those are reasons why people may not reach out to us as well. Fear of people of authority, fear of people who might have what you may see as us having power, and also fear of legal repercussions. And I want to reassure you that what you tell us in session, we don't go reporting that. All right, we are required by our college and by our privacy rules that what you tell us is private and confidential. We have some times where we have to break the bounds between the client and the therapist, and we take those very seriously. So for example, if you are suicidal and you have a plan on how you're going to kill yourself, we take that very seriously. We don't want you to harm yourselves. We want you to get medical attention at that point in time and get you to a place of safety so you get help. So there are times like that we do have to break the client therapist confidentiality, but we do not report to CBSA. We do not report to the Refugee Board. We don't work for them. They don't have control over us. So I want you to know that you can talk with us without fear that we're going to talk to somebody else about your case. I think that's really important. All right. It's also important you understand that your interim federal health plan gives you access to medical care as well. We're not physicians, but you can go to the hospital, you can go to the clinic and use that insurance, okay? And also if you are going to go speak with a doctor or someone at the hospital, if you have to have additional medical tests for some reason, the hospitals can provide you with interpreters as well. So don't be afraid to ask for one. They do have a list of people to call who will do the translation for you or the interpretation for you while you're seeing the doctor. Okay? Practical issues also can be transportation problems, childcare, getting time off work. And that's why we have virtual appointments like this so that you don't have to come on the bus or do an Uber to come into our offices. We have therapists who work in Ottawa and throughout Ontario, so we can see clients anywhere in Ontario. Some of our therapists have dual licenses. They work in other provinces such as Manitoba, Saskatchewan, and Alberta, so we can see clients from those provinces as well virtually. Right? Some of the other issues of even accessing counseling besides the language is also gender. Some of our clients, being women coming from cultures where women, stayed at home and it was the men who made all the decisions, may be more isolated and not know they can reach out to us. Also, when we have clients who are from different sexual orientations, that could be a big fear to come and talk with a therapist. But I want to reassure you that we as therapists, we're parts of us, some of us are part of the LGBTQ plus community, and we're all LGBTQ friendly and informed. I'm going to reiterate, counseling is confidential. And it's really important because a lot of people are concerned, are we going to report things back to your lawyer? Are we going to talk to somebody else? No. The counseling that we provide here at Family Therapy is supportive conversation. This is not interrogation. All right. We encourage you to be able to be open and honest with us, and we understand that building trust is something that happens over time. We're never going to force you to have conversations about experiences that you had, traumatic experiences. We want to help you eventually process that information and get over the trauma or work through the trauma and find better solutions for what you're going through. But counseling is a confidential, safe space where you can be you can talk about what you need to talk, and you can explore different ideas and thoughts. One of the things I do say to my clients is, if there is something your lawyer needs to know that is really hard for you to talk about, I want you to know you can talk to me about that, and I will help you communicate that information to your lawyer. All right, and that's really important for your refugee board hearing. And I'll give an example. One of my clients had actually fled their home country. They went somewhere else to study. While they were there, they decided they wanted to try to claim asylum. The country that they were in did not accept their asylum claim because they didn't do it the same day they arrived at the airport. This is now months later, and they were very promptly deported back to their home country. This is information that's really pertinent to someone's refugee board hearing, but the client never told the lawyer. Now, I met the client after they had their hearing, so not before, so we couldn't have this conversation. But that would have been something that if a client was working with me and that had come up in session somehow, or the client mentioned it in passing, I would say this is really important information that your lawyer needs to know, because it's really crucial for your refugee board hearing. But we don't communicate with your lawyer unless you give us your permission. And same thing communicating with a family doctor. Unless we have your permission, we can't communicate information. Now, you may say, well, why am I going to come for therapy anyhow? Why is talking about this helpful? One of the things that we might not know is that sometimes a lot of the things that we're experiencing are because of our traumas. So you might be feeling racing heart, racing thoughts, having insomnia is a huge one. You're irritable more than usual, because we all get irritable time to time. You have body aches and pains that the doctor can't find out. Currently, I have a client who has lots of body aches, tightness in the neck, in his ear, throbbing, and they've done all sorts of tests. There's nothing physically wrong, but it's the stress. Okay, so a lot of times you have body signs, you have physical signs, or even mental signs that things aren't going quite well for you. You can't seem to stop them. And those might be signs that your body is trying to tell you that there's things you need to talk about so that you get them off your chest, is an expression we say in English. You unload them and share the burden with somebody else. So I'm going to go back to the thought about the mind and body connection. All right. Trauma shows up in our bodies if we keep on holding on to it. All right. And we don't know. A lot of times I've mentioned the new health issues. So some of you may be suffering from high blood pressure. That's a very common issue. You might have developed diabetes as well. All right. Sometimes we have aches and pains. Your back is always hurting you, but there's no reason why, or aches in your arms, your legs. Like the gentleman I have, really bad pain on one side of his neck that there's no rhyme or reason for it. Migraines, sleeping issues is a huge issue that many of our refugee clients complain to us about. And also the top one, it says you may be experiencing, but that really should say racing thoughts. All right, you're trying to go to sleep and you're having a lot of thoughts, or during the day you might be at work and you can't hear someone talking to you because you're off daydreaming about something, or you're reliving an experience that you have. So this is your mind and your body kind of working together, taking all that stress and putting it somewhere in your body, in your mind, and it impacts your day-to-day life. All right, so counseling can help you understand the body-mind connections, and we can give you tools to help you alleviate some of these symptoms. So we do things like, it's called CBT for insomnia, helping you, giving you tricks, trying different techniques to help you when you can't sleep at night. All right, that would be one thing that definitely I can say we do. All right. Now, it's important for you to realize that when you have a reaction to the trauma that you've experienced, and it's not even might be a big trauma, it could even just be you had to leave home really fast. It's not your fault. You didn't do anything wrong. You're not doing anything wrong now. You're not broken. It's that your body is just reacting to things that you've gone through. And part of therapy is really to help people figure out how to slow down these reactions, how to stop them, and how to start responding differently. Okay, so we can help you reduce the emotional overwhelm that you experience. So a lot of my clients say to me, Natasha, I can't think, I can't concentrate. I'm going into the kitchen to do something, and instead of going to the fridge where I was going to go, or the cupboard, I end up by the cooker, or I've gone in the room 5 times. I still cannot remember what I wanted to get. Or sometimes I find myself just sitting there and I've lost track of time, or I've sat on the bus and I've missed my bus stop. Those are all signs that you are being overwhelmed by your trauma. So we can help you with the emotional overwhelm. So there are different techniques that we can do. So I did talk to you a little bit about the CBT for insomnia. Other things your therapist can help you with when you're ready is there's exposure therapy, where we talk about what you've gone through, but we also teach you how to manage your emotional responses. All right, so we never throw you into the deep end and push you to do anything before you're ready. We're going to prepare you, whether we do breathing exercises, grounding exercises, create, I'll use the word safety plan in this context, so that you are prepared. And we do what we call, I'm going to use the word even bridging. Okay, so over here is where you are maybe right now, overwhelmed, anxious, depressed, worried, and we want to get you over here to a calmer place. That could be a really big gap here. Okay, so we're going to move very slow steps by steps by steps by steps by steps to get you over here. All right, and that's really important, because I've had clients over the course of therapy start remembering their trauma, events that they had buried, events they couldn't remember, and they were not in their narratives for their refugee board hearing. And so we got them into their narratives, and that was really helpful. All right, and that's really helpful for you, for your refugee board hearing, that you have all the details of what you went through, all the important events in your paperwork for the board member to read before you attend your hearing. So here we are. I've kind of talked about it a little bit already. Organizing your story is a big one. So it's really important to get your narrative down in as much detail as possible, to have all the events there for your refugee board hearing. That's a really big, important step have a positive pass at your refugee board hearing. Process your trauma. We carry our trauma with us, and it's really important that we actually start leaving it here in our offices. All right? You don't want to be carrying, you're always going to remember what happened to you, but you don't have to carry the emotions, the guilt, the shame, the overwhelm, the fear. You don't have to carry that part with you. So that is how we process memories, by talking about them, teaching you grounding techniques, having you write the story out multiple times, learning how to breathe through it, staying calm. And I know I make it sound so simple, and you're like, well, if it's only that easy, your therapist will be with you. As we start to process your trauma, you're no longer up here on high alert all the time. And your brain only has, think about your brain like a bottle of water, right? If it's full of anxiety, worry, fear, there's not much room left in that bottle for you to start concentrating, to have a good memory, to be able to focus on things. And so as we reduce your anxiety and your fears, that part on top where you can start really thinking about things, remembering things, being more calm, collected, and things like taking care of your day-to-day tasks, right? Remembering where you left your car keys, remembering where you left your bus pass, or even I had one lady, she would lose her purse quite a few times on the bus. That part of being more organized, as we process your trauma, you will see that happen in your life, that you're not so scattered. Okay, so that's going to also improve your memory and build your confidence. As you get confident in talking about your narrative with your therapist, it'll be easier to talk with somebody else for your refugee board hearing. And that's really important, all right? Because a lot of times when we struggle to remember our words and we stumble over things, or how we remember things are out of order, can impact our hearing. And it doesn't mean that your story is not true. It just means you just are remembering bits and pieces here and there, but it's really hard for you to think about it in a linear pattern. We are going to be with you every step of the way as you go through the refugee process. All right. We want to be there with you up front, helping you adjust to being in Canada, helping you learn about things that you may need, supporting you in a lot of, I'll say, the settlement issues. So some of our therapists can help you with that as well. And then also helping you prepare emotionally and mentally for your refugee board hearing. All right, because that's why you're here. And we will attend your refugee board hearing with you as your emotional support person. Okay? It's your therapy can help you. I'm just going to read off of here. All right, practice grounding skill techniques so you can use them at your hearing. Manage fear of authority figures. That's a big issue many people have because they were harassed by not just the military, but even just the everyday police. And I reassure clients here, the police here in Canada are your friends. They will not ask for a bribe. They will not come and invade your homes for reasons of sexual orientation or political reasons why you left your home country. All right. And then we help you also process the difficult feelings you might have experienced during your hearing, and we're there to support your mental and emotional well-being throughout the whole process. Okay, some of the things that we do is we can do all the things before the hearing, but your social worker or psychotherapist will write up a case summary for your refugee board hearing to let the board member know how you have been impacted by your trauma and how that may show up at your refugee board hearing. All right. We also do things like ask for accommodations. So if you need a female therapist, or you want a female board member or a male board member at your hearing, Right? We will ask somebody who has been educated on sexual orientation issues. We will alert the board member if you cannot talk about your trauma. So they can ask questions, but they're not going to ask you to directly talk about it. All right, especially if you're a victim of sexual assault or torture, we don't need to know the details. Okay, we will continue meeting with you until you receive the outcome of your refugee board hearing and beyond that. So for some of our clients who don't have a good refugee board hearing, have a negative outcome, we're there to walk you through the appeal process, an H&C application, and so your journey with us does not end abruptly. For people who do have a positive outcome, you have a little bit more time with us to maybe process more of your trauma if you want, and to learn more about what the PR process is after your refugee board hearing. Okay, how does therapy help me? So really, these are both just 4 things. We provide documentation and professional support. Therapy will help you improve your ability to share your story with a stranger, because you would never talk about that with anybody else. You're only having to talk about it because you're making a refugee claim. We help build emotional readiness before your hearing so that you can talk about things that are hard to talk about. And our main goal really is to help reduce the impact of trauma on your day-to-day life. Okay, again, we provide your case summary reports, we attend your hearing with you, and we provide recommendations to the board member on what would make your hearing easier for you. Okay, you're going to have to do the work yourself, but it's our job to help make it as easy for you as possible. So a lot of people wonder what happens at my refugee board hearing. Okay, so you're going to see those list of things. You have the right to have the refugee board hearing in your language of choice. It doesn't have to be English. It can be whatever language you are the most comfortable in. Okay, on average, a refugee board hearing lasts 3 hours. Sometimes we've attended hearings that are much longer. So sometimes if it's a case where there's a lot of interpretation that has to happen, it can be longer. If it's a very complex case, sometimes that may last longer. If you and your spouse are both testifying, it could last longer. In my experience, we average about 180 questions. I've seen refugee board hearings. My shortest refugee board hearing was, I'll say, 20 minutes. We had a very extremely understanding LGBTQ board member, and it was very fast. All right. Other hearings, I've actually sometimes had a hearing that lasted, I'll say, 2 sessions. We had our hearing that was 3 hours. The board members still had questions, and we came back a second time. And I know that can be very distressful for the clients, but you're still entitled to come see us. We're there to support you and talk with you about what happens at those situations. Okay, the main focus of the hearing is really telling the story in your words. The board member has all your information, has read the story, and they will ask questions. All right, so if there's something that's not clear in the story, how you ended up here and you went over here, and how long did you stay at this place for, and why did you go there, they're going to ask questions about that. All right, and that's something that our therapists do help you with because we do attend hearings. I personally write down all the questions of every refugee board hearing I've been to, and so I can help my clients, giving them what a sample looks like. And there are sample refugee board hearings on the internet, on YouTube, that you can watch as well, that give you a little bit of an education of what a refugee board looks like. The biggest challenges you'll face is when there's a mismatch between your stories and your documents. And the board member will ask you, like, in your story you said you were here, but the document that you got from somebody sending a support letter says something different. Why? What's happening here? Or even Why could you not obtain documents? And there's lots of reasons why people cannot obtain documents from their home country. The board member wants to understand that, and we'll ask you questions about that. Sometimes we have clients who have their children are here in Canada with them. And you might be a single parent, you might have children back home, and you may find that you are changing or behaving differently than you would back home because of your trauma. And I think that's really important that we talk a little bit about that, because we do have therapists who can work with teens. We don't have a child therapist yet in our office who works with refugee children, but we do have a therapist who works with teenagers. And I think that's really important because children need to know that they are safe no matter what's going on. Okay? Your children need to have, if your children are here with you, they need to be in a routine. They need your reassurance that things are going to be okay. And you going to therapy will help your children heal as well. All right. And I think that's really important. Sometimes parents are afraid to come in because they're afraid of what their teenager will think if they know if they're going to therapy. But also they're sometimes having trouble parenting because of their trauma. All right. So I have had parents say to me, my kids tell me I'm more angry than usual, or, my daughter's noticing I'm really forgetful, or my kids talk to me, I can't hear, or I'm really short-tempered and losing my patience with them. But they're just being kids, they're not being bad children. So those are signs that really reach out for help with us to talk about those issues so we can help you be the parent that you know you can be. Also, if you have children, and right now we can work with teenagers who have been impacted by violence, bring them into therapy as well. There's nothing wrong with your child, but untreated therapy can have long-term repercussions on how they study at school. It could show up like ADHD. So your children are having trouble focusing at school, or their grades are dropping. It can show up at things like your teenager's more moody, or even your child's more moody and withdrawn. I have a family right now where their children have very quiet because they witnessed a lot of violence while they were escaping their home country. All right, your children can seem fine, but it could be like years later that you find out that this is really causing them a lot of grief. Okay, your children might have signs of fear or anxiety, changes in eating habits. They're not doing well at school. Sometimes the children, when they're not able to talk about trauma and they don't have the vocabulary for it, children act out trauma. So for one of the families I'm working with, one of their child is going around hitting the other kids in the house, and that's not usually how that child behaves. So we're working on helping the parent address that with their child in a healthy way that doesn't shame the child or make the child feel that they're wrong, but so that we're going to help the child work and discuss. And what we do with children who are young, we do what's called play therapy. So the children can play out what they need to talk about, or they draw it out. And that's how children get out their trauma. All right. You may also notice your children have sleep problems or fear. So fear is a really big one, and clinginess is another one. So your child doesn't want to sleep alone by themselves. They're always in your room, always in your bed. They don't want to go outside. Going to school is really hard for them. So that's a really big sign that your child's been really impacted by trauma. So just how do I get therapy? So your fees for counseling services are covered by the interim federal health plan that you got a little card for maybe, but that's the insurance that pays for visiting the doctors here in Canada, and some dentist care, eye care, any medication that you may need if you have to go to the hospital and have an operation. And it covers our services as well as counselors. It also covers, so if you ever got injured while coming to Canada, all right, whether you might be limping or you have a sore arm or something happened that you got hurt, we have what's called physiotherapy here in Canada. And the interim federal health plan also covers physiotherapy. You just need the same thing. You need to get a referral from your doctor saying that you need physiotherapy. All right, so you have a valid UCI number and interim federal health plan coverage. You get a referral for counseling from a doctor. We do have physicians that we do work with that we refer our clients to. So it's kind of like we have a little bit of a hotline with a couple of doctors. So if you don't have a doctor, don't worry about that. Let our receptionist know, and we can get you an appointment. We can help you get the appointment to get the referral. Okay? We want to make therapy as accessible as possible because you've had enough challenges in life. Mental health shouldn't be one of them. So we offer, again, remote or in-person options. All right. Coming to therapy, easy. You just reach out to us and we will get you set up with our intake worker who's going to help you fill out the forms before you see your therapist. All right. We can help you get a prescription for your counseling services. We have therapists who speak different languages. And we have the access to interpreters. Your insurance plan, the interim federal health plan, also covers part of the fees or all of the fees depending on the cost of the interpreter. So we can help arrange an interpreter and get some money to cover that as well. If you have been exposed to domestic violence, there's free interpretation for those services. How do you get to us? So you can call us, text us, email us, or visit our website and fill out a form on the website. Okay, I do have your email addresses from when you signed up. I'm going to send you this little package to you about how to sign up for counseling services if you're interested. This is really informative, but it really is important that you do get some care for yourself. Okay. So now we're at the part where we're going to figure out how to unmute you and have you ask some questions. So I'm going to end the share here and figure out how to unmute you all.